healthy subscribers, welcome to another episode with me today. And so today we're talking about why every fever isn't malaria. I know many of us, we are guilty of this. You have headache, body temperature, oh, I'm having running nose, I think I have malaria. It might not be malaria. Let me give you the shocker. So today we are going to be learning what fever is and how to identify what causes those fever and how to spot the type of fever you're having and what conditions it might be. So let's go in. When we talk about fever, we're talking about the body response to some kind of strange activities that is happening in the body. Let's take for instance someone who barge into your house and the first thing you see at the sight of that person is to scream. That screaming we can tag it as fever. So fever is a kind of response, something strange happening to the body, and this something strange could involve different conditions or sickness or whatever kind of reaction that must have taken place. At times you have fever whenever you have injury. So today note that fever is a body response to a kind of condition that is happening in the body, and this is why you would not just relate it to only malaria. So there are different things that triggers fever. Of course, malaria is one of it. There are also different things. So let's go there. Infections triggers fever. In what sense? When there is an invasion of bacteria in the bloodstream, then the body is trying to send signal to the defense mechanisms of the body to start preparing, and then the body system begins to develop high body temperature as a result of it trying to fight against those bacteria before you now start making use of your drugs or whatsoever. And so that is a trigger for fever. Another trigger for fever is also malaria. Of course, you know malaria is caused by a parasite known as Plasmodium falciparum, and so when this invades the bloodstream, it tends to do some kind of mago. Of course, that's for science students, and then your body starts to react to that invasion, and then it sends a signal, of course, which triggers your body defense mechanisms, and this in turn gears up the body temperature, and then you start to have a fever. Another thing that triggers fever is viral infections, and you would also recall then when we had the COVID-19, one of the symptoms of COVID-19 is high fever. Some other thing that triggers fever, at times medications triggers fever. Medication trigger fever. Inflammatory activities, like maybe you have an injury and then your body is trying to heal at that point in time, tend to have fever. And that's why at times when you have fever and maybe you go to the hospital, like we will not totally say fever is high body temperature, but it is usually a body temperature above the normal body temperature of human being, which is 37 degrees Celsius. So when we're having something around 38 down to 40, such individual is having fever. So some individuals have this fever, have that high body temperature at times when they are trying to recover from some conditions, from some wounds, from some injuries and all of that. So at times you just find out that the doctor will just ask you to just go have a cold bath or just dip a towel in water and mop the body, and you'll be fine, instead of prescribing some medications for you to use. So now to the main story. How do you spot if this fever is for malaria, is for infection, is the viral infection, what have you. So when you have a fever with chills, you start sweating profusely, and then you have headache, and then you have body pain, and then you feel so tired. Like all of this comes one after the other, and then it comes and goes. Like many people used to experience these symptoms I mentioned in the night. Some may experience it early in the daytime, some experience it just maybe once, and then after 2 days or later in the day it comes again. Like all of those things I've mentioned, like at least 2 or 3 of those symptoms I mentioned, then you should trace that fever to malaria. How do you know ascertain that it's truly malaria? You go for test, and then you will be very shocked that that fever is signaling to you that you are down with malaria. Fever that comes with running nose, that comes with cough, that comes with sore throat, of course it signals to you that you are down with some kind of infections, and it could be typhoid, it could be urinary tract infections, it could be throat infections, it could be ear infections, whatever kind of infection. So it is signaling to you to go and meet your healthcare provider, let them diagnose the kind of infection it is and give you the appropriate antibiotics that is necessary. And then for urinary tract infection, it comes with fever, comes with burning sensation during urination, comes with lower back pain or waist pain. Then you should know that this is signaling to you that you might be down with urinary tract infection. And then another infection that comes with fever is typhoid. So one way to spot typhoid when you have fever is when you're also having a kind of stomach upset, like you just feel that sharp pain somewhere at the lower part of your abdomen, and then this pain goes, come, and at times it stays longer, and then you're feeling nauseated. Then you are experiencing fever, of course, the high body temperature. That's the signal that you might be down with typhoid. So the best thing to do is to pick yourself up, go to the hospital, go run a test, and then get the necessary medications that is needed. And at times, your fever might be as a result of some medications you take, some non-steroidal anti-inflammatory medications you take. So now you know that every fever isn't malaria, and every malaria doesn't come with just fever alone. It comes in episode with its own symptoms. I hope you're able to enjoy today's episode. Stay tuned for more health tips from LT. Please like, share, and make your comments. I would be reading your comments. Thank you.